going to be talking about substance abuse and alcohol today. We help people manage existing chronic diseases, finding affordable health insurance. We have smoking cessation program to help you quit smoking. We have walking groups. You can participate in some of our monthly and weekly peer support groups in various languages. And we can also help people connect to local health and social services. If you need any more information, our numbers on the screen, our email.
So exactly what is substance abuse? And we're saying that substance abuse can also be referred to as drug abuse. It is an excessive consumption of or misuse of drugs for non-therapeutic effects on the mind and body. It can also be considered to be an overuse of drugs that may or may not have been prescribed by a medical practitioner. That is what is considered to be substance abuse. What is a drug? A drug is a natural or synthetic substance used in the diagnosis, treatment, or prevention of a disease or to relieve pain. It can also be considered to be a habit-forming substance that produces a state of arousal, contentment, euphoria, and or sleep-inducing properties. Or a drug can be addictive when used continuously or excessively, with possible withdrawal symptoms when drug use is stopped. And it can also be legal or illegal.
There are many types of drugs that can be abused. Alcohol, liquor, wine, beer. There's also nicotine, cigarettes, cigars, chewing tobacco, and vaping. Inhalants such as glue, gases, GHB, which is a designer drug, such as date rape drug, which is also known as a roofies or a Valium. Those are in pill form, but most of them are used to make someone do something without remembering. There's pills called ecstasy, Molly, which is usually in a pill or sticker form. There's cannabis, weed, marijuana, reefer, ganja, and so many others for that specific drug. There's also something that's been arising more so since the pandemic. It's synthetic marijuana. It's called K2. A lot of people begin using it because they think that it can't be found in their system. However, it has terrorizing effects. Opioids. Opioids may be used in the treatment of diseases. However, it can lead to abuse, such as fentanyl, oxycodone, morphine, Vicodin. Those are very much powerful drugs that we've seen the demise of a lot of superstars. Michael Jackson, Prince, lots of stars have overcome to these type of opioids. Also, there's cocaine or crack, which is a form of cocaine that is cooked up into a rock form. Also, there's heroin, also known as doogie or dope. Those are just some of the drugs, but those are some of the most common drugs that can be abused.
What are some of the causes of substance abuse? And according to the Mayo Clinic, the two major causes of substance abuse are environmental. Now, environmental causes would include your family's beliefs and attitudes. If your family will allow drugs in the house, but then there are other families who will not tolerate it. They will not even have anything in their homes, they will not tolerate it. So according to your family's beliefs and attitudes towards drugs. Another thing is the exposure to peer group that encourage drug use. If your friends drink and smoke, you will be encouraged to drink and smoke as well. And these two things play an initial role in somebody using drugs. Another cause of drug use can be attributed to genetics. Genetics says that once you have started using the drug, the development into abuser may be influenced by inherited genetic traits, which may speed up or delay the disease progression. So if you may have had a relative who may have been challenged with substance abuse, you might find that if you take a substance, that you too might be challenged with that same substance. So it might, if you know that you have family members who are addicts, it might do you well to stay away from these drugs. So some of the risk factors of substance abuse is that people of any age, sex, or economic status can become addicted to a drug. Certain factors can affect the likelihood and speed of developing an addiction. Your family history of addiction. Drug addiction is more common in some families and likely involves genetics. Right? If you have a blood relative, such as a parent or sibling, with alcohol or drug addiction, you are at a greater risk of developing a drug addiction. Mental health disorder. If you have a mental health disorder such as depression, attention deficit hyperactive disorder, or post-traumatic stress disorder, you're more likely to become addicted to a drug. Using drugs can become a way of coping with painful feelings such as anxiety, depression, and loneliness, and can make these problems even worse. Peer pressure. Peer pressure is a strong factor in starting to use and misuse drugs, particularly in younger people. Lack of family involvement. Difficult family situations or lack of a bond with your parents or siblings may increase the risk of addiction and can cause a lack of parental supervision. Early use. Using drugs at an early age can cause changes in the developing brain and increase the likelihood of progressing to drug addiction. And taking a highly addictive drug, some drugs such as stimulants, such as cocaine or opioid painkillers, may result in faster development of addiction than other drugs. Smoking or injecting drugs can increase the potential of addiction. Taking drugs considered less addicting or so-called light drugs can start you on a pathway of drug use and addiction. So some of the symptoms of substance use disorder include having intense urge for the drug that block out any other thoughts. All you think about is getting this drug. Taking higher amounts of the drug over a longer period than you intended. So it takes more of the drug to get you to where where you want to be as far as getting high. Spending money on the drug, even though you can't afford it. Continuing to use the drug, even though you know it causes problems in your life or causing you physical or psychological harm. Doing things to get the drug that you normally wouldn't do, such as stealing. Failing in your attempts to stop using the drug. You're thinking about stopping, you know you should stop, you want to stop, and yet you still cannot stop. And experiencing withdrawal symptoms when you attempt to stop taking the drug. When you try stopping the drug, you feel so ill and it causes you to go right back on. So these are some of the symptoms of substance use.
There are some ways that you can recognize symptoms in people, symptoms of drug abuse. Someone may begin having problems at school or at work. They begin to have physical health issues. They're always coughing, not sleeping a lot. You know, their eyes are red. Okay, they neglect their appearance. Okay, then definitely there are symptoms such as changes in behavior, mood swings. They become very aggravated, very moody. Also, money issues. They begin to excessively ask you for money, or they never have money as they were used to. Why addressing substance abuse is very important, right? Because substance abuse has a major impact on individuals. It has an impact on families and communities. The effects of substance abuse are cumulative, significantly contributing to costly social, physical, mental, and public health problems.
Substance use disorders or abuse can have multiple behavioral problems, both in short term and long term. And some of them can be, we talk about, they include paranoia. Some people become paranoid when you smoke drugs, when you use drugs. You see things, you hear things, you think that people want to do you something. Then you become aggressive, and nobody can say anything to you. People start to hallucinate, and that is where you see and hear things around you, and you start to feel things crawling on your skin, that leads to addiction. You know, and when you get addicted, you have impaired judgment. You make decisions that are not the best for you or your family. You are impulsive. You have lost self-control, and then you become depressed. And depression is a major concern. Depression is going to lead you back to the drug, and then it becomes a cycle.
Life-changing complications of substance abuse on an individual. Dependence on drugs can create several dangerous and damaging complications, including getting a communicable disease, sexual abuse.
Yes, sometimes when you're people who are addicted to a drug are more likely to get an infectious disease, such as HIV, because people share needles, and you can become HIV positive. And you can even get HIV and other STIs because you have unprotected sex, because you are high. All right. Other health problems. Drug addiction can lead to a large range of both short-term and long-term mental health problems. Um, Mental and physical health problems. You can get, we talk about mental health, you can get depressed. With physical health, you have, when you smoke, you always hear the Surgeon General talk about you get cancers, different type of cancers, lung cancer, colon cancer, and stuff like that with smoking. You can get things like emphysema and COPD. There are lots of advertisements on TV that highlights stuff like that. And with other drugs can cause you heart problems. So you have a lot of physical issues and mental issues. We have accidents, DUI, DWI, driving under the influence, driving while intoxicated. If you have a job that you have to do machinery, you're also prone to accidents.
Taxi cab drivers, forklift machine operators, all such things. You can hurt yourself, injure yourself, lose a limb, hit someone with a car.
Suicidal thoughts, and suicide itself. There's an increase in suicide while people are high. Using substance gives you more of that thought, and people do sometimes commit suicide because they're high. You have family problems. Behavioral changes can cause family conflict, work-related issues. You don't show up to work, or when you're on work, you're not showing up. You're hiding. You're not doing what it is you're supposed to do. And you end up unemployed. You have problems at school for younger people. When you're on drugs, you don't want to go to school, or you go to school and you don't do anything. And then we have legal issues. Because once you're on drugs, legal problems are common for drug users and can stem from buying or possessing illegal substances.
Okay.
And then you have financial problems. They will always come back to financial problems.
Of course, the constant struggle of trying to find that money to get that next hit or that next snort or that next drink. So there's always issues with money when you are addicted to a substance. Substance abuse is also not just an individual disease, it's also a family disease. When a family member uses drugs, it affects the whole family. If using drugs start to consume your life, your relationships become less important. You may withdraw from your family members and activities. What if using drugs become a need and turns into an addiction? When you use drugs, others can no longer count on you to do what you say you're going to do. And they say, you stop at the store, can you bring some bread? You go out, you never come back with the bread. Loss of trust by family members. And also, you can incite a family feud. You may become rebellious and defiant with parents, guardians, siblings, and other family members. Also, you may have mood swings, paranoia, and irrational anger, which you may take out on your family members. So that's how sometimes substance abuse is a family disease, because not only does it affect the user or the addicted person, it affects the whole family.
And to continue as a family disease, you may be verbally and physically assaultive to others. Yes, and it affects the whole family when you're fighting everybody all the time. You may start stealing things, money, credit cards, and other valuable items so that you can sell, so that you can buy your drugs. Understand? You no longer spend time with the family and do things that you usually used to do together. You put stress on parents and guardians because they are fearful of a child who will hurt themselves or someone else or even die. And people who use drugs don't see the damage and hurt they cause in other people. That's why trying to talk to somebody, trying to have a conversation, trying to have intervention with people, they can't see that they are affecting you. And the whole family that affected it is disruptive, and the whole stability of the family goes off.
And but also tobacco use, right? And a lot of people may not think that tobacco use is a strong drug that affect the family, but it can't, because if you're a smoker and the rest of your family doesn't smoke, then you have to go outside. So you may miss some of the family's functionings because you can't be inside of the house smoking. The smoking may affect your younger children, right? You can't be smoking around the babies, or if young babies in the home may get asthma if you're a smoker. So that's the way that smoking cigarettes and smoking tobacco can harm your family. So, people think that smoking cigarettes is, oh, it's just me, it's affecting me. But no, it can hurt your family. The smoke in the house, or the smoke in your clothing, or the smoking smell in your furniture can affect your families, your young ones, your children that surround you. Secondhand smoke is one of the leading causes of asthma attacks in the household, right? So we got to remember that it's not just the other strong substances, because people think that, oh, I just smoke cigarettes, but yeah, cigarettes is a part of keeping you away from your family.
So in the community, substance loss of productivity and unemployment. We have impaired physical and mental health. Right? People are not well. It's reduced quality of life. You don't want to come outside, because when you come outside, what are you going to see? You understand? You can't come outside and walk around and enjoy the weather. You don't want to send your children outside, the parks. Violence and crime, including physical fights. Somebody always fighting. There's always blood on the ground. There's always police activity in the area. There's always shooting. So it's not an easy situation. And you have problems with housing and homelessness and vagrancy.
Mm-hmm. You have the children that begin to become left behind, abused and neglected, as well as was saying, it does ruin your family. Mm-hmm. And then also the substance abuse affects the community, mass incarceration in our communities where substance abuse is very, very common. And those are some of the ways that, drug abuse definitely affects our community. That's where it shows it's not just an individual problem, it's a family problem, it's a community problem, and an individual problem.
And we talk about HIV and AIDS and other STIs also affects the community, because people are sharing needles, and that affects the whole outlook of the community. You have a lot of motor vehicle incidents, whether it involves other motor vehicles, or it involves pedestrians, or it involves scooters and bicycles and stuff like that. A lot of crashes, a lot of people speeding because people are under the influence. And then you have homicide, plenty shooting leads, and plenty gun violence leads to deaths. And then suicides, people not feeling very good about themselves.
There has been an observable increase in substance abuse and drug overdose during the pandemic. People who abuse substances are at increased risk for poor COVID-19 symptoms and outcomes. Researchers have observed increases in substance use and drug overdoses in the United States since the COVID-19 pandemic was declared a national emergency in March of 2020. The COVID-19 pandemic also presents unique challenges for people with substance use disorders and those also in recovery, such as isolation, loneliness, anxiety, depression, fear, unemployment, and boredom. When the pandemic came, people were prone to use drugs because they couldn't go outside, they couldn't hug their loved ones, they lost their jobs. So all of those played a factor in increased drug abuse during, the pandemic. Because of these factors, National Institute on Drug Abuse plays an important role in the federal response to the COVID-19 pandemic. Who is NIDA? They are the National Institute of Drug Abuse. However, they support research, training, and career development through partnerships as well as grants and contracts to research investigators around the country. They are important because of the pandemic. So many people lost their jobs. So many people lost their housing. There was no place open where anyone could go to get any type of help or any type of counseling. So that's why it was very important for them to stay there, to continue to give people grants, and so that people will have ways to still combat substance abuse. They can also help to identify the biological, environmental, behavioral, and social causes and consequences of drug abuse and addiction across the lifespan, meaning, people are dying young and old due to substance abuse, and they're able to try to keep the numbers of who, where, what, and how, and where the most people and the most impact is needed for help. They help to increase the public health impact of NIDA researching programs.
So in case you have an emergency, like if you see someone might be having a difficult time, you might see somebody who may have overdosed. If they show changes in consciousness, you might see people showing these signs. They may be having trouble breathing. They may be having seizures or convulsions. They might show signs that they may be having a possible heart attack, such as holding their chest or can't raise their arms or something like that. And they have other troublesome physical or psychological reaction. So people might be running around yelling and screaming. So that might be an emergency, a drug-induced emergency. At that point, we need to get help for people. We cannot leave people in situations like that without help. So we call 911. And when someone comes, usually if it is an opioid overdose, they will have something like you see on the screen we call a Narcan naloxone kit. It's called it Narcan. You see a lot of people around with it, people who have been trained by the Department of Health. And anybody can get trained to use Narcan. It is not difficult. There are trainings all over, and they give you a little kit, and the little kit will have the nasal spray like this, and you can use it to revive someone. So if you may have people who may be on substances, and you may have opportunities to assist them in ways like this can be a good idea. You can call 311 and inquire as to where you can get the training and get the supply. All of this thing about drug abuse, drugs and abuse is a lot of information, but we have good news.
Good news.
All right. Substance abuse is treatable. Okay, you can get treatment for it. There's individualized therapy sessions, which include behavior therapy and counseling. Okay, you can go to rehab. You have inpatient rehab, you have outpatient rehab. You have the TUX program. All right. There's also pharmacotherapy, which is medication that they give you to assist with the cravings. So you have like the methadone. People go to the methadone clinics and they get the methadone.
So that's more like when you have an opioid or a heroin addiction.
Mm-hmm. And then, like if you smoke cigarettes and you have problems with nicotine, you get Chantix. You go to your primary care doctor and you get your prescription of Chantix, and it helps. Okay.
The cravings for the nicotine.
And then you have the peer support groups. You go to every 2 or 3 blocks around you. There is an Alcohol Anonymous. Yeah, thousands of them in the city. Or you have Narcotics Anonymous. You go and you sit with your peers and you discuss your challenges, and you will always get encouragement and ideas on how to help you to decrease decrease the rate of ingestion.
Once you've been addicted to a drug, you're at high risk of falling back into the pattern of addiction. If you do start using a drug again, it's likely you'll lose control over its use again, even if you've had treatment and you haven't used the drug for some time.
You can stick to your treatment plan. You went to rehab, you had a social worker, you had an addiction counselor, you had an intervention plan, you had your own individualized treatment plan. You stick to your plan. You monitor your cravings. You know what it is, what your triggers are. So you monitor your cravings. And it may seem like you've recovered and you don't need to take steps anymore to stay drug-free, but there is a chance that staying drug-free will be much higher if you continue seeking your therapy and from your counselor. Going to your support group meeting and taking your prescribed drugs. So stick to your plan. Don't stop. All right? Avoid high-risk situations. Don't go back to the block that you used to smoke with the guys. Don't go back there. Don't walk past by these people and them. Don't look for them. Don't call them. Stay away from the drugs. Stay away from the crowd. All right? And get help immediately if you use the drug again. Sometimes things might happen and it's difficult to cope. So you might end up taking a hit. But that does not mean that you're back to using. You go back to your treatment plan because you have a treatment plan. You have your drug to stop the craving. You go back to the basics, back to the drawing board, and you start over again. It is not the end of anything. All you have to do is to keep that plan, that treatment plan, in the back of your mind and never stop.
Keep using your resources.
Mm-hmm.
Know that they are always there for you. Okay, that's always definitely a good way to prevent relapse once you've been susceptible to drug addiction.